Hello, this is Dr. Do again. This video is alphabetic list of problems on letter L, and I start with lung and the lung diseases. Previous couple of videos I talked about the pneumonia, which is quite common lung diseases, stratifying different age group from children, elderly or middle-aged, and with different causes, depends whether it's community acquired or healthcare acquired pneumonia. And today I'm going to move on to another lung disease, which is also quite common, asthma. And let me just bring the first the topic. Is any associated condition with this asthma need warrant emergency visit? Yes, you probably know it. The acute exacerbation of the asthma is really, if you have that, if you had history of asthma, you probably know it. And your physician probably already talk to you what kind of signs, and if you have the inhaler, you just need to use it right away, and then don't forget to see your physician, go to the emergency room to just double check. And so basically, what are the signs? You probably know it. Difficulty breathing, really wheezing, and change the color of the lips or the skin, and really hard, difficult breathing. So these are the signs for the asthma exacerbation, so you need to get it managed as soon as possible. Even though you probably have the inhaler at home, but still after you inhale after the problem improved, but still inform your physician, go check it, or emergency, or your physician, to make sure it's completely recovered and completely very well managed from this acute exacerbation, the episode. And is there any condition associated with this asthma you can manage at home? I'm not saying this manage at home. Yes, you can. You can just get the inhaler if you have mild form. Talking about mild form is less than a week, less one time per week, and your physician probably prescribe your inhaler just in case in handy, and you have it. But still, that's not managed at home. It's really it's prescribed medication under the instruction from your physicians. And I recommend for those who have mild asthma, have this inhaler at home, and have a logbook, see what time, how many times a week you use it, and how many puffs. A detailed logbook will really not just only benefit you, actually it's good for your physician to have information about your condition. Either sometimes maybe the asthma change with getting worse, or maybe getting better with age, with growing older. I'm talking about the young children to adult. So this, but and also it also applied may getting worse. So just have a logbook at home, and periodically to show to your physician, and to your physician will have idea when to adjust the medication for you. So this is about the two ends, the emergency and home management. And talk about the asthma. What is the asthma? The asthma is really just the hives on the skin. It's the allergy in the respiratory system. You probably know it. And the mechanism of this allergy is similar. It's like the extra inflammatory chemicals, or the IgE, the immunoglobulin IgE type, cause this releasing the chemicals to constrict the bronchi and the bronchioles, cause this narrowed respiratory tract pathway, so causing the symptoms. That's just the fundamental, very not difficult to understand. In terms of why there's some people has it, some people don't. Why you have IgE, I do not have this. This is individualized, probably individual, probably previously exposed to the viral infection or genetic. Some people probably, I think the early time viral infection, probably one of the quite common causes of this asthma later on. And in terms of the management or the diagnosis, it's not difficult to diagnose when you have this kind of wheezing, difficult breathing, and with or without infection. So bring to the physician if it's your children or it's yourself. Go see your physician. Your physician will listen to your lung. Basically, it's clinical diagnose. Listen to the lungs, hear the wheezing, and also your history, your family history, and then give you the medications. You probably know. Usually start with the dilator unless the acute exacerbation or some other complication. Use systemic medication like the steroid or the other medication to decrease this mast cell or secreted chemicals. So this is about the asthma. In terms of the management, there's a very well regulated criteria for either mild, moderate, or severe asthma based on the oxygen level, based on the episode of this asthma each week, or based on the day and night symptoms, and also the oxygen level, essential to determine the severity and also give you the medication, whether you should use it as you need it, or whether you should use it regularly twice a day, or whether you should be added some systemic medications. So this is really up to the physician after you are examined and required your history, acquired history from you yourself, the patient, and then the physician will determine whether it's mild or moderate or severe asthma. So these are and in terms of the dilator, it's the agonist of beta 2. So this talk about this agonist of beta 2 is kind of confusing. Actually, it's really a receptor for the sympathetic nervous system. The beta 1, beta 2, and on the other hand, if beta 1 beta blocker, for example, sometimes not selective. So for those hypertension people had asthma and also the hypertension. Probably when you were young, you had asthma, and now you had hypertension. Your physician will prescribe you medication. Some of the physicians prefer the first-line beta blockers. You need to let your physician know that you used to have the asthma, because this beta blocker will cause the constriction of the trachea, or a constriction of the bronchial or bronchi. So these are for the older people had a remote history for asthma, and this is I brought here just thinking about to explain the mechanism of constriction of the bronchial and also the bronchi. So mention about those who had history of asthma and now managing the hypertension. You need to let your physician know. And also the complication for this asthma, if it's not managed well, of course the long-term hypoxia will cause one of the form of COPD. So this is a chronic obstructive lung disease, actually pulmonary diseases. In addition to the emphysema and also bronchitis, this asthma, if long-term not very well managed, can also have this COPD as a complication. So I think this is very, in general, I did not think about this topic until the moment I sit in front of camera, think about the asthma. So I may miss some information which is important, but I try to put the clinical picture to you and how the physician prescribe your medication. It's just not in their mind. There is a written criteria for mild or different severity of asthma, so prescribe different medication. So I'm going to stop here today and hope it helps, and thank you for watching. I will see you next time.